This is a site that is closing in March.
These sites offer a lot more than just watching people use drugs.
They get help here that they wouldn't get in a hospital, and they would get it done quicker here.
We do not supply drugs here in this space.
If I knew now, back then, my brother would still be alive.
You can't recover, you can't be stabilized if you're dead.
They said that, you know what, we have a spot for you. You should have been not self-medicating. You should have had a doctor a long time ago. When they offered me that, I started to cry.
No, I think I have one of the best jobs in the city, because my day is spent building relationships and strengthening relationships with clients.
Of course, we respond to overdoses. We respond to at least 1 or 2 every single day. In addition to overdose response services in the site, we offer in-house referrals to dentistry, physiotherapy, get people connected to primary care and get them a family doctor or nurse practitioner.
And they'll help me get my resumes done and all of that so I can go back to work again.
We're able to give in-house referrals to counseling and HIV program, Hep C program, and external referrals to detox if that's what people want, treatment beds if that's what people want.
I've had a really bad accident. And so I went into a hip and lost a tree. So I wasn't too keen on doing the opioid thing. But that's a big part of what started the addiction.
I always tell people, you're one breakup, divorce, separation, job loss, depressive episode away from an addiction. And I say that to say just the stories of clients, what caused them to use, and it's usually based in trauma.
Everybody's affected by at least one family member, apparently, or relationship down the road by someone that's self-medicating.
Hi there, I'd like to welcome you to the Parkdale Queen West Supervised Consumption Site here in Toronto, Ontario. My name is Ray Clark, and I'm here to give you a client tour of what our service looks like. When clients enter the space, there's a check-in booth. They give us their anonymous code. We do not track the identity of the folks that are here. This is an anonymous service. Also, when clients check in here, we ensure that they have their pre-obtained drugs to use, as we do not supply drugs here.
My first experience of harm reduction was as someone seeking help. I grew up in Toronto with a lot of resources. I have a lot of support from my family. I had my education paid for. I've never had to worry about having a roof over my head. And still, when I was addicted to crystal meth. And when I wanted to seek help for that, I wasn't ready at that time to go for abstinence. That was too scary for me. Harm reduction was my foot in the door.
It takes time and process to move people towards a place where they may be ready for treatment. People are pre-contemplative. They have to there's a lot of movement and support that people need along the way to even get to that place. We know from data that people are at an increased risk of overdose when they're in these kind of in-between stages of their life, where they've just been released from jail or just been discharged from treatment, or they're waiting to get into a treatment bed and they're on a wait list. These are the gaps that overdose prevention sites fill, because people, knowing that risk, can come to a service where there's healthcare providers and peer workers.
I used to be a service user here, and then I became an employee here.
And I said, are you guys really gonna help me? And they said, we can help you as much as we can, but you don't have to live on the streets. You don't have to self-medicate if you really want to change that. And I said, I want to change it. And so they gave me that choice. It wasn't forced on me, it was offered to me. And I was so tired of self-medicating.
I think there are people who think that we are like enablers, and that it could be like further from the truth. I think people who use, they're going to use regardless. We just ensure that they use safely.
Like, I heard the word overdose, I thought like death. Like, it's like someone is just dead. And it's so scary. It really is, it's just it's so different. That's the thing, I'm like, it's so different than I ever thought it was. I'm
happy to ask you other questions.
Sorry, no, I want to say this. So during the pandemic was when I started working with this community. I had a lot of my own hangups, and I just didn't know. I was like, is this going to be dangerous? I could not have had a more different experience dealing with these people.
Harm reduction is basically the idea that rather than trying to penalize people for doing drugs, we want to keep them safe and give them opportunities to take charge of their own health. So the idea is really just meeting people where they are at in this moment, not trying to change their, the trajectory of their life, but just trying to keep them alive. And it gives them clear view of the possibilities that exist down the road, whether it's treatment, whether it's supplemental like medications like methadone or Suboxone, or some sort of like stepping stone in the path of that direction. There are people that want treatment. Right now, I think it's a current wait of about 6 months for any like Ontario OHIP funded treatment programs. You can't predict what's going to happen in 6 months. You're asking people who are daily using an unregulated drug supply to hope that they're going to be alive in 6 months when that bed becomes available.
So I think often folks' journey here may begin with interfacing with one of our client support workers, who then puts them in touch with the appropriate service, whether that's primary care, whether that's harm reduction, whether that's supervised consumption, whether that's counseling. We have a number of services within the building that all collaborate with our supervised consumption site.
I think the understanding sometimes of this space in particular is that we're just a safe consumption site. We are a community health center, so our range of services go from primary care to all community. When we say community health center, we mean community. It means everybody that lives in that community, which means there are children coming for primary care to come to see their dentist. There's like elderly people coming to do physiotherapy. Like there's people doing the diabetes program to come and do yoga on Tuesdays.
This is a foot care station, so a lot of the folks that we serve are people experiencing homelessness, and they're on their feet all day, and oftentimes people can't afford good footwear. People are getting used footwear that may fit appropriately or may not. All of our overdose prevention support staff and myself are trained in the in-low foot assessment for diabetic neuropathy and other things.
So we will talk about the community, and we mean people who come into this building. I will hear from people who are talking about the community, and they mean people who own a condo nearby. The community is both. Wanting to not see a problem doesn't make it go away. I think seeing people in pain is uncomfortable. It's sad, naturally people people don't want to see the fact that some people live on the street. That makes them sad. It makes me sad. That doesn't mean that they don't live there.
Discomfort is okay, but I feel as a, how do you, as like a citizen, as a community member, feel watching a fellow citizen, a fellow community member in that state?
things that made me feel like a part of a community and a bigger picture. And from that, I was able to apply for a job. These clients are very valuable people, and so that's a big driver as why I even wanted to get into this work, was to give back and make sure that didn't happen to anyone else.
I've been here for just under 3 years, and this really is like it's home. Like, it's a beautiful space. Like, it comes alive. It's filled with art and culture, and everybody is really taking care of each other inside and out. If you live in a community, you should know everybody that's in that community. People that are unhoused are also your neighbors.
I think what's being lost in all of this political discourse and opinion pieces is that each of these lives is somebody who has hobbies, has friends, has family, has interests. These aren't just like disposable. Every life is precious, including the lives of people who use drugs.
I love to work out. Like, I really like working out. I like the way it makes me feel.
I got back into knitting. I got back into doing a bit of sports as much as I could with my hip, right? Like swimming and all this that connected me with all these things.
I read a lot. I like reading. But nowadays they take a little longer to read. I like true stories, and I like history.
My favorite season of the year is the winter. I love like walking in the snow, but it can get pretty cold outside because a lot of people that have addiction problems are not housed. We've got, 10,000 people right now in the streets. There's tents in all the parks. In this place in the daytime said, you know what, come on in and get warmed up, have a coffee. Are you okay? And that's the most important words to hear is, are you okay? Because at minus 20 below when you're out there in the tent, you're not okay.
There are really amazing people who have come into this site. People, people who are painters or former journalists or are so much more than just someone who uses drugs. And I don't think you can choose that life doesn't matter.
Supervised consumption sites are a really beautiful service that really does catch people when they fall through the cracks of the healthcare system in lots of different capacities.
They would do better in a place like this where they have RPNs here or nurses here that will do the minor stuff, that they don't have to get an okay from a doctor to deal with it. It not being a doctor, it would be a nurse.
I think these issues wouldn't be as stark as they are right now if there was sustained government financial support to the social services sector. If we were able to find permanent housing for someone and supports around that housing, we would actually be saving a lot more money in the long run.
The real problem is an opiate epidemic that everyone is aware of now, which I feel like generally, if you're going to deal with a problem, you need people to be alive.
People want to use in a safe, private place, and for lots of my folks who don't have housing, the only spaces available in society for them to use are public spaces.
The vast majority of clients that I work with at one point or another has said, I'm tired of this. And they've asked us to arrange detox beds, and then for us as workers, it's frustrating that when we call the central intake number, there are no publicly funded detox beds. Clients are quoted amounts between $20,000 and $30,000 for a 30-day stay.
We've had supervised consumption sites in Ontario for about 7-8 years. And in that short amount of time, we've received a lot of data, actually, about the benefits that supervised consumption sites have on the surrounding community.
These sites were situated right in those neighborhoods where EMS was having the greatest concentration of overdose calls. And what we have seen is a dramatic reduction in the number of EMS calls and fatal overdoses within a kilometer of the site.
A social worker is only as good as the resources that they are able to provide. Over the last few decades, social workers have been really hampered by the resources we're able to provide.
Funding increase could scale up the operations of existing supervised consumption sites. We can address community concerns. We can approach our neighbors, and we can talk about how we can mitigate and coexist together. This isn't an all or nothing kind of game, but with the decision to close SCSs, for some of our clients, it becomes an all or nothing game.
You feel like you only have seconds, but you have minutes. You don't have hours. So we're there to respond quickly and calmly.
Many people have experienced calling 911 where there's more than a 8, 15, 20-minute wait, even in Toronto. And one of my fears for when these sites are closed is that emergency medical services are not going to be able to keep up with all the calls that they're going to be getting.
I'll bring you into the SCS, or the Supervised Consumption Room. As you can see, we have 4 booths. In this particular site, we supervise or witness 800 injections a month. On average, we have between 40 and 60 overdoses per month that we reverse or treat with oxygen.
I've seen people take like 4 breaths in a minute. That's not enough. But if what they're breathing in is pure oxygen, then you're preventing brain damage.
So a client's normal journey, they would come in, give us their code, tell us what they're using. They would ask for their harm reduction supplies. Syringes, tourniquets, sterile water, alcohol swabs. Clean supplies every time. We do not supply drugs. The risk of HIV infection and other bloodborne infections is greatly reduced.
The street supply, which we know through Toronto's drug checking service, it's contaminated with other drugs that people don't even think they're buying.
So another service that our clients have access to is Toronto's drug checking service. One, it provides important information to clients about trends in the drug supply seen in the city. And the second service that it provides is we can take a sample of their drugs and we can send it for analysis at one of 2 labs in Toronto.
People don't know the potency of what they're getting. It could be much weaker than what they bought yesterday, or it could be 10 times stronger, 1,000 times stronger, which really sets people up for overdoses. People can go to the LCBO and buy a bottle of whiskey where they know exactly the alcohol content of it, and they can see that it's not adulterated, and they know the potency, and they know that there's nothing else that can affect their health in what they're buying.
Like bars are safe consumption sites. I'm doing my smart serve now, and I'm seeing the similarities between what we do here and what a bartender does, right?
We just don't stigmatize alcohol as much as we do other substances.
For people to think that if you abolish these safe consumption sites, that there's suddenly not going to be any more drug use, that is very short-sighted. If you oppose and you close a safe consumption site, your entire community is now an unsupervised consumption site.
The needle exchange program here is at least 30 years old.
The community worries about things like finding needles and finding paraphernalia, which is valid, a valid concern. Nobody in this space wants there to be needles and paraphernalia lying around. That's not what we're advocating for.
There's a perception that supervised consumption sites make drug use more visible and bring it into the public eye more, but the opposite of that is true. What happens in these sites is healthcare and overdose response, and I don't want that to fall into the public domain where it puts everyday neighbors and community members and families in the role of overdose response workers. It would be really meaningful for politicians to come into these sites. And I think there's a lot of value to actually look at the faces of the people who are impacted by these policy changes. and hear from actual community about the harms that are going to be created.